Welcome back. Today marks the start of National Nurses Week, and Nurse Lori Brown thought the best way to celebrate our healthcare workers is with a little bit of help and advice from local experts. Good morning to you, Lori. Let me start off by thanking you on this National Nurses Day. We are so happy to honor you, our real-life superheroes.
Thank you. I'm glad to be here.
Yeah, Lori, let's begin with this. During the AIDS crisis, you were on the front lines at St. John's Hospital in Santa Monica, and you're saying what the nurses are dealing with right now is actually worse. Can you explain that?
Just because in sheer volume of numbers, there's so many more patients experiencing COVID-19 versus at the time of the AIDS epidemic. Like, they didn't have full floors just for AIDS patients like they have floors or units right now just for COVID-19 patients. It was just very different, and just because the volume.
What are the biggest struggles you think for healthcare workers right now? Because you're not a nurse now, you're not working in the hospitals anymore, but you did for many, many years, and you're talking to lots of nurses, lots of healthcare workers. What do you think the biggest struggles are?
I think there's a lot of stress out there. Putting on the equipment is very physically exhausting. I don't know, in San Diego now we have to wear a mask, and that decreases our oxygen consumption. And can you imagine wearing a mask for a 12-hour shift and having to constantly change and re-put on your gowns, your mask, your everything for each patient? It's just physically draining.
What about the mental stress too, the fear of getting it, then bringing it home to your family, seeing patients so sick, seeing patients dying?
Oh, it's really sad. I remember during the AIDS crisis, I would just go home and lay awake at night thinking about these people that were suffering, and my heart just went out to them. And I know how they might feel is about the stress and the fear and the concern for their patients.
So what are you doing? What's your part to help our medical healthcare workers? I know you used your own money. You have created a resource to help our healthcare workers. What exactly is this?
So when this hit, I was just devastated about all of my peers going out to work and being exposed in these situations with not enough equipment and supplies, things like that. And we already have a stressed healthcare, not enough nurses anyways. And so I thought, what could I do? What could I give to them? So I looked at what I was experiencing back then in the AIDS crisis and what would have helped me. And so I put together 18 experts who, I have an infectious disease physician, a homeopathic practitioner, hypnotherapy, emotional freedom technique, which is tapping, mindfulness, meditation, yoga, you name it, immunity boosters, gut health, every expert, sleep expert, every expert I could think of that would help nurses. And we did a video, a bite-sized 20-minute, up to about 20 minutes, maybe 30 at the most, of things that they can implement right now to help them, to help increase their immunity, decrease their stress, everything that they would need right now.
Essentially a COVID-19 survival guide. What are some of the nurses or healthcare workers who have been to that website? By the way, what is the website? Where can they find that information? And what is the feedback you're getting?
Okay, so it's empowered, past tense, empowerednurses.org/COVID, empowerednurses.org/COVID. I have just received a bunch of gratitude and thanking me for putting this together and how useful those videos have been for them. Now, and not only have I received letters of gratitude or emails or whatnot, but also not just from the nurses, but from their family members. Because when you're so stressed like this, all you want to do is come home and you're still, all wound up, and you can't enjoy your family, and some of them are afraid to even be with their family. So this survival guide, I got emails from family members thanking me as well.
That is awesome. As you mentioned, empowerednurses.org/COVID. We have that information as well on the screen. We'll also post it to our website, cbs8.com. Lori, thank you so much. A big thank you to all of the nurses, the healthcare workers on the front lines. I know the hours you're putting in, they're long. As you mentioned, they have their own families. It's not easy. So, Lori, thank you so much.
Thank you.